Welcome back on the Health Watch. Waiting rooms across South Florida are filled with flu patients. So what do you do if you have a health issue or question, but you don't want to expose yourself to a virus?
Or maybe it's after hours and you're not sure if your problem warrants a trip to urgent care or the ER. As I'll show you, all you need to do is grab your phone.
How are you feeling?
It may look like Dr. Tina Carol Scott is just chatting on her phone.
No fevers or anything like that.
But she's actually working.
She also completed the full course of Tamiflu.
Dr. Scott is one of a growing number of healthcare providers turning to telemedicine to treat patients at the South Miami Children's Clinic.
I think it's just kind of like the natural next step for medicine. And I think that we need to meet patients where they are, and this is what they're asking for.
Through the Medici app, Dr. Scott can either text, talk, or video chat with patients. They can safely upload their medical history and photos, and she can provide answers and advice on the spot.
It's taken my practice to the next level. Now patients can text me, they can upload photographs, and if I need to take it to another level as far as doing either an audio conference or video consult, I can do that as well if it's necessary. And it's completely safe, HIPAA compliant, and secure.
Dr. Scott says she does about 35 to 40 telehealth consults a week. A Jackson Healthcare study estimated 7 million patients would be turning to telemedicine by 2018, and it's on track to become a $36.2 billion business by 2020. Parents like Aisha on a recent call with Dr. Scott are loving it.
Very convenient for me, and my schedule is crazy. It's always hectic, so this app is convenient.
Even if your doctor doesn't offer this type of service, it doesn't mean you can't take advantage of this type of technology. Other apps like Doctor on Demand allow you to consult with a healthcare provider through an app on your phone.
I tried it.
My name is Lauren.
I answered some questions and chatted with a doctor, all in a matter of minutes without leaving work.
Okay, perfect. Thank you so much.
While telemedicine may save you a trip to the doctor's office in the short term, a recent health affairs study found these phone-a-physician services may increase access to care, but they don't decrease overall healthcare spending, as patients don't always use it as a substitute for in-person visits. In the case of Dr. Scott's patients, she doesn't charge them, but other services do require a fee or copay from the patient.
Okay, and I hope you feel better.
One of the goals of this type of technology is to empower patients, and Dr. Scott says it's definitely empowered her practice to better serve the community.
I think that it's definitely improved my relationship with patients, and it's improved overall care, and it's decreased emergency room visits tremendously.
Dr. Scott doesn't charge her patients at all, but some providers do charge or may bill your insurance and collect a copay. There are a variety of apps out there you can try. We'll list some of the most popular ones on our website, cbsmiami.com.